Alright, well and truly overdue update. I've got it written down there, and I'm going, oh. Alright, I'm officially 3 months on T. More than 3 months on T. I am, hold on. 3 months, 1 week, and 2 days on T. Alright. I went for my top surgery consult with Dr. Andy Ives. In, where is he located? Windsor. I went with my mum. So it was just him explaining what's going on, if I wanted to go with him, sort of thing. Complications, risks, and he made a comment. He was like, because he legally has to, after this, there's no going back, blah blah blah. Then we had a conversation, and he told me to take my shirt off. So took my shirt off, laid on this little bed thing, and he felt around. I also had to take my binder off. Felt around to see if there was any lumps or anything in my armpits, anything like that. The whole time he was touching, I was looking at him because I didn't want to see my chest, and I could see that he wasn't looking at all. He was just feeling as if he was touching his stomach. I don't know. Then after that, he's like, "All right, you can get dressed, champ." Got dressed. And I was like, okay, I didn't find any lumps, blah, blah, blah. And then he was like, if you want to book with me, you got to have a second appointment in case you have any questions or anything like that. Also, if I lose a significant amount of weight, I will have to go and have another consultation with him again. First consultation was $300. Was it $300 or $200? I forget. This is why I should do updates more often. But then second, third consults are free. And then that, I'm pretty sure, not too sure, I don't know, that consultation fee might get deducted from the overall surgery fee. So that happened. I then, while I was there, I got the quote, if you have private health insurance, and he has 2 places that he operates at. He has Masada Private Hospital, or he's also got his own private surgery clinic thing next door to his consultation rooms. Now, a lot of insurance companies get that mixed up with the Avenue Hospital because the address of next door is number 20, the Avenue. And the Avenue Hospital is literally down the road. Like, I think it was like 10 houses down. Like this place, his private surgery rooms look like a house from the outside, and apparently on the inside you walk in and it's just like, it looks like a hospital. I got a quote for both places that he operates at, because one I was covered at and the other one I wasn't, which was the one at Masada that my private health insurance covers adds up to $5,600, and the one where my health insurance company doesn't have a contract with, which is number 20, the Avenue, that one costs $8,100. Now, from both of them, you get the Medicare rebate, but at the same time, even though my private health fund doesn't have a contract with number 20, the Avenue, I can still get a rebate back off my private health fund because it is it has a Medicare item number, and it's not listed as cosmetic. And if it was cosmetic, it wouldn't have a Medicare item number, but it does. So I can get a rebate off my private health fund, even though they don't have a contract with number 20, the Avenue. Granted, I won't get as much as I would have if I went to Masada, but yeah. So after researching all that and having to figure out that myself of how much it would have been and all that sort of stuff, I ended up deciding to go with having surgery next door, which is number 20 The Avenue, the one where my private health fund doesn't have a contract and it'll cost me $8,100. I decided that because that surgery date that I could book in was on January the 6th. Now, if I wanted to go to Masada, I would have had to wait till January the 30th. Yes, it's not that much of a difference, but my theory is I don't want to go through another summer binding, and getting surgery end of Jan would mean I would be binding, because you have to wear a post-surgery binder for 6 weeks. I'd be binding till mid-March, and I don't want to do that. I figure at least get a month in of summer of no binding. At least get a month in of summer where I can go swimming. I can be topless at the beach and not have to wait a whole fucking year to do that. That is my theory. At the moment, I am $1,400 away from having all my money for surgery. Surgery is in 109 days, 12 hours, 2 minutes, and 21 seconds. So yeah, that's probably married. I ended up booking for the 6th of January 2015. Now, I don't know what time I'm going in. I'll get a package sent to me. Well, not a package, a thick-ass envelope stating what I have to do before surgery, how long I need to fast, any medications I need to get, any prescriptions I think, and all that sort of stuff. I'll get that early December so that I can sort that out. I also went to a second top surgery consultation with Andy Ives because I had to, and that appointment was for me to ask any questions, but that consultation didn't cost me anything. Only the first consultation did. Now, some questions that I ended up thinking of that he didn't mention in the first consultation. Yeah, it was just trivial shit for me post-op, mainly. And I'll read them out because I also wrote down the answers as well. I asked how long before I can go swimming in a pool or at the beach, and his response was 4 to 6 weeks. Just wait until all wounds are healed up completely and there's no open wounds to create some form of infection, because you don't want that. Also, I want to get my chest tattooed after surgery, and said that I should wait at least a year and a half, make sure I'm happy with the results. If I want, get a revision. And actually, no, he said 6 months. 6 months. It was, I think, Garamoni that said it, you had to wait 1 year. Don't quote me on that. I don't know. I didn't have a consultation with him. I asked him if I should shave my chest before surgery, and he said, no need. If it needs to happen, we'll do it before we cut you open. He didn't say those words exactly. My choice of words. But from previous friends of mine experiences, shave your stomach. Everyone's got fucking a snail trail, at most, and when they do it, they end up putting a massive bandage that pretty much goes over your belly button, and that's to hold the drain tubes up so they don't pull. And one of my mates didn't even think of that, and he had to try and peel that off because the pulling, the hair, So, recommendation, shave your stomach. Shave your torso. I've also heard people saying to shave your armpits because drainage, band-aids, hair and sticky shit don't mix. If you've done t-shirts and put band-aids on, you would know that. Next question was, I've heard I should wait a year before exposing my chest to the sun What about wearing zinc over the scars and nipples? And he's like, no need. If I want to rip my shirt off, then I can. His words. I asked him what will be happening on the day, or is that something I should ask your assistant receptionist? Literally, this is how he works. His receptionist books him in and tells him where to go, what to do. Well, not exactly what to do, but like, she organizes everything, she runs it, and he just slices and dices and talks to people about what he does. His receptionist organizes quotes, money, booking in, and any questions relating to that sort of stuff and timing and all that sort of stuff. Receptionist takes care of. So no point in asking him how much it's going to cost, what date you have free, and all that sort of stuff. You talk to the receptionist about that. Don't even bother, because he will just tell you to go talk to a receptionist. And I asked the receptionist what will be happening on the day, and that's when she said, we'll be sending you out a package early December in preparation for that. Everything isn't organised just yet because there might be other people booking in that might need an earlier time or whatever. I personally am not fussed because I'm going to be staying the night there anyway, so whatevs. I asked when the drains come out and when the nipple dressings come off, because they have like those yellow nipple things. I want to touch my own nipple, which is further down to where my nipple will be after surgery. Drains come out day 5, and then nipples are day 7 to 9, depending on what day of the week it falls on, because he doesn't work on Saturday, Sunday. So it just depends what day of the week that falls on. And that's all the questions I asked, really. To book in for surgery, I had to pay a deposit of $300 to be able to secure a date, sort of thing. Other reason why I'm also waiting till January, and it's now September, is work. I work pretty much full time. I'm not classified as full time, but I work Monday to Friday, 8 till 4:30. So I have a job, sort of thing. So got to deal with that. And the most appropriate time for me to take time off is after Christmas, and the 6th of Jan is the first available date after Christmas, and I'm able to take time off work. Those 6 weeks that is recommended to take time off, I booked in my leave. I booked in my leave before actually settling on a date. I have my leave organised for next year, surgery date booked in. I need another $1,400 for surgery, which I should have in about a month, depending what happens, what comes along. That's what's happening with top surgery.